Switching your Medicare plan can feel confusing and even scary, whether it's during the annual enrollment period or any time a life change triggers a new need for coverage. It's stressful. With over 17 years of helping seniors navigate the complexity of Medicare, I know how overwhelming it can feel to consider a plan change. In this video, we'll cover why it's important to review your plan, common mistakes to avoid, and how to make the best choice for your needs. Whether you're watching this during the annual enrollment period from October 15th to December 7th or any other time of the year, stick with me, and by the end you'll feel confident and empowered to make a plan change if needed. So, why even review your plan? Often people that are enrolled into Medicare Advantage plans or prescription drug plans forget that every year Medicare allows the Medicare Advantage carrier and the prescription drug plan carrier to submit plan changes and requires Medicare Advantage plans and prescription drug plans to submit plan changes. And then this typically happens in May, June, and by July, plans are approved for the upcoming year. Now, during those plan changes, often what you are not aware of and don't pay attention to is that copays, deductibles, the drug formularies, the premiums on the plan, the out-of-pocket max on the plan can go from $3,500 to $4,500 one year. The hospital copay that you used to pay that was $200 5 years ago, now you go to the hospital and all of a sudden it's $350 day 1 through 5 as opposed to $200. And why does this occur? Well, every year with the cost of living adjustments, Medicare Advantage plans, prescription drug plans, and based on their star ratings and all these moving parts, the drug plans themselves are going to have massive amounts of change, especially going into years like 2025 when you have the Inflation Reduction Act and the reducing and elimination of the coverage gap and the reduction of a $2,000 max out of pocket. All of a sudden that changes a lot of the dynamics. As I've been telling people, it's like a whack-a-mole effect. You knock down a price here and it pops up prices in other places, and you inquiring and making sure that your copays, your deductibles, your medications haven't changed, the plan formularies haven't changed. Also, a lot of times, again, people will focus on dental, vision, and hearing benefits in a Medicare Advantage plan. To me, I would just want to know, are my doctors covered, my specialists covered, the hospitals of my choice, and are my medications covered, and what plan should I stay on? A lot of times you don't need to change, but often if there's changes in the copay costs and there's medication changes, a lot of times people can save $400, $500, $600, $700, $800 a given year by just changing plans. Now, the last thing I wanted to talk to you about this is you can be enrolled into a Humana Medicare Advantage plan. Let's say you're part of a Humana HMO plan. You can enroll a lot of times into another Humana plan because you love Humana, they've had great customer service for you, and you're happy with the carrier, but the plan itself, a lot of times in a given market, there's 4, 5, 6, 7, 8 different plan options, and it's important that you look at, hey, I've been on a plan, now all of a sudden this plan has a premium and higher copay cost. Is there another plan with that same carrier that can lower the premium or have no premium at lower copay costs? And often the answer to that is yes. Inquiring about that and making sure that you get a review is important. Often we talk about the annual notice of change, or what's called as A-NOC. In September of every year, you're going to get an A-NOC, or an annual notice of change. Now, typically, the A-NOC is pretty easy to read. It's going to tell you your current year, and it's going to tell you the upcoming year, and it's going to have a side-by-side comparison that allows you to see, hey, my doctor copay is $0, and the next year is $0. My specialist copay was $10 this year, but next year it's $15. The hospitalization copay was $250, now it's going to $275. And my encouragement is when you get you're kind of lining out when is a good time to review over your option to determine whether or not you need to even call your licensed agent or agency, or if you don't have one, partner up with somebody that knows what they're doing, that can give you guidance to be able to go to answer key questions when looking over the A-NOC. A lot of times there's changes in the A-NOC you may not understand that somebody like myself would understand and explain that and articulate that for you. But it's very important to open the A-NOC and to look at the side-by-side comparison. You'll also realize that medication, all Medicare Advantage plans and or the prescription drug plans, the standalone Part D plans, they change. The formulary, they may have a list of 700 drugs one year. The next year they may marginalize that down to 600. Understand the rule for prescription drugs, they have to have at least 2 drugs per drug category. So some categories like cholesterol medication may have 10 drugs. Some drugs for injectables for diabetic medications like insulins, they may only have 4 drugs. Maybe prior to, they had 6 drugs and covered your medication. Coming into the new year, they may be dropping that insulin. You need to be aware of, is my medication covered? Because if not, you're gonna either have to request an authorization to have the medication put on the formulary, which means it's gonna go to a tier 4. You're gonna have a higher copay cost. It's gonna throw a lot of things off in your formulary. But not getting a review often will cost you tons of money. I have seen people enroll into a Medicare Advantage plan that's been on the market for 10 years and it had a premium when it first came out and had very, very low copay costs. Access to care was almost zero on most items. And over the years, they kept the premium, that they increased the copay cost on those plans, when in the same market with the same carrier, they can enroll into a different plan with a zero premium and much lower copay cost. Again, I won't get into the complexities of why that happens on this video, but making sure you review your options, and then also remind yourself that if you've missed this October the 15th to December 7th, the annual enrollment period window, you also have from January the 1st to March the 31st called the open enrollment period, that you can change from a Medicare Advantage plan to another Medicare Advantage plan. And then if you have certain special elections, given that you change addresses, you move, there's all types of special elections that can happen to a person. It's about 2 pages of listed special elections that we look at to determine if somebody can make a plan change. You may be experiencing one of these special elections that allows you to be able to change. If you've been healthy and now diagnosed with a chronic illness, they have chronic illness plans that allow you to change once. If you have fixed low income and you qualify for low income subsidy help on your medication, you have a quarterly change you can make. If you qualify for state Medicaid, you have a quarterly change you can make. But if you don't know and you're unaware and you just, again, assume that I don't have an opportunity to be able to change, don't assume. Don't think that you're right and then be wrong without calling a licensed professional and allowing them to be able to answer questions. Hey, I get it. Medicare is extremely confusing. Most people are confused about their own Medicare health plan. They've just been using the plan. They don't ask a lot of questions. And then when something major happens, they're confused about what the cost is. Don't cause yourself a lot of stress. And especially don't be confused about things that can be simplified. Call someone that can help educate you on how Medicare works and your health plan option that you've chosen, how that works. If you do have questions, get a Medicare review done every year. If you don't have a licensed professional that keeps up with that for you, I would say give us a call, schedule a time below. We'd love to be able to review over your plan. If it's October 15th to December 7th that you're watching this, great. If it's past then, call anyway. We'll schedule a time and look and review your plan options with you, and love to be able to give you some directions and answer any questions that you need answered.